Page number 15 in new textbook. So, you will have a little bit of abbreviations in this chapter. Okay, so understand the abbreviations, know the abbreviations. When you read this chapter, underline the abbreviations. Questions related to that can come. Okay, difference between these two major abbreviations, EAR and RDA. So, EAR stands for Estimated Average Requirement. RDA is Recommended Daily Allowances. Okay. EAR is the only set for nutrients that have functional markers. Okay. Like, for example, the nutrients that have a functional role in your body, vitamins and all. Okay. And it can meet the needs of 50% of the population group. For example, if you say EAR of calcium is 500 gram. Okay, so if every citizen of your country is having 500 gram of calcium on a daily basis, okay, it is still not covering the remaining sections. Okay, when I show you the graph, you will understand that. So EAR is the average daily nutritional intake level, which is estimated to meet the requirement of half of the healthy individuals. Okay, right now India has a population of 1.3, 1.4 billion people. Okay, so if policies are made, okay, the food policies, the nutritional policies of our country, if they are made on EAR, we can only fulfill the requirements of 50% of the population. The remaining 50% will be either overnourished or undernourished. Usually they will be undernourished. Okay, so EAR will give you an average. Okay, for example, Indian population. India is still a young country. Okay, average of the average age in India right now is around 29, 30. Okay, that is the average age. Okay, of the entire population, the age that we see and take an average of it, 29 estimated is around 29. Okay, so if yeah, just imagine, okay, um, for a 29-year-old adult, Indian population, Indian policy makers, nutritional policy makers, government subsidiaries, okay, they all are making policies based on this 29-year-old and adult, any reference man or woman. Okay, they are 29-year-old. Okay, based on this 29-year-old man or woman, okay, they are making their food policies, nutritional policies, okay, agricultural reforms. Okay, these things are made on this age group, this particular age of 29. Will it be okay? Will it be the right way to cover the entire population? Will these policies be justified for rest of the population? It will not. Okay, it will hardly cover the requirements of 50% of the population, not the remaining 50%, because the requirements, okay, requirements of a 29-year-old person is very different from a growing child, an infant, an old senior citizen, pregnant woman, lactating woman. Okay, we are completely forgetting these other aspects of the population. Okay, so that is EAR. Is it clear to all? All this EAR is completely based on average. Okay, what is the average of the population, and based on that average, when you make vitamin mineral requirement, you will get the correct answer, but it's not justified, okay, to be used in national level policies. And when you are making a national level policies, it is very important that national level policies, state level policies, any policies that you make at a reformative level, it has to give maximum benefits to the majority of the population. Okay. So those things are considered in making national policy. RDA, on the other hand, RDA, it is also based on EAR. Okay. EARs give a foundation for RDA to be met. Okay. So let's say EAR of 800 mg of calcium was understood. Okay. Now, when you make RDA out of this information, it is very easy to make an RDA based on age group, because RDAs are based on age group. Now you know the EAR. Average requirement is at least 500 to 600 gram of calcium you should have on a daily basis. Okay, irrespective of your age. So RDA will give you more information. What age, which gender, what disease conditions. Okay, RDA is using the information from EAR. Okay, baseline is 600 or 700 mg. From here, where we can go. If you're dealing with a senior citizen, what should we give? It should be double than that. Okay. If you're dealing with a lactating woman, what should we give? Again, double. Pregnant woman, at least 1000. Growing children, again, 1000 mg. Okay. So RDA is using EAR as a foundational knowledge to move further. Okay. So RDA will meet at least 97 to 98% of the population. When you are making your national level policies based on RDA, okay, you are ensuring sufficient coverage, nutritional coverage for 97 to 98% of the population. Okay, why? Because we want to prevent deficiencies and chronic diseases that roots from deficiencies. Okay, specifically those chronic diseases, we are aiming to prevent those situations, health situations, by basing our national policies on RDAs. Okay, is it clear the difference between RDA and EAR? So when you see this graph, this is a normal distribution curve. Okay, what is a normal distribution curve? See, when I give you a set of data and ask you to find the mean, median, mode, are you aware of these statistical terms? Like this is like 10th standard mathematics, 9th and 10th standard mathematics. The statistics is there, no? The chapter of statistics. Mean, median, mode. Mean means what? It's the average. Okay. Sum of the observation divided by number of the observation. That is mean, average. Okay. Median. What is median? Middlemost. What is the middlemost value? Arrange all the numbers in ascending order or descending order. What is the middlemost number? That is the median. If it is odd number, the set of the observation are odd numbers. There is one single number in the middle. So that is the median. Okay. But if it is the set of number is even, if I give you 10 numerical data, okay. So, and you arrange those numbers in ascending or descending order. Okay. 10 numerical data. And I ask you to find the median. There is no midpoint. Okay. There is a fifth number and a sixth number. Okay. So you have to add the fifth observation, sixth observation divided by 2. You will get the median. Okay. You can check these formulas on internet. It's very easy to understand the basics of statistics. Okay. So that is median, middlemost value. Okay. Arrange the set of data in ascending or descending order. Then you will find the middlemost value. Okay. Now, mode. What is mode? The most repeated number. If I give you 10 different numbers, data set of 10 numbers, okay, you will see how many numbers are repetitive, how many times 1 was there, how many times 5 was there, okay, or any other value, how many times it was repeated. So the most repeated data or the most repeated observation is called mode. Okay. So whenever you get a data set in which you have found out the mean, median, mode, and you observe that the value of mean, median, and mode are all the same. Okay. Let's say, for example, you got an average of 5.6 in a given uh, question. Okay. In a set of the data, you found an average of 5.6. You found a median that is also 5.6. You found mode for that data that is also 5.6. So mean, median, mode are overlapping. They all are the same number. So that's when you get a normal distribution curve, this bell-shaped curve. Okay. When you put that data into graph, you will get a normal distribution curve because the mean, median, mode are the same. Okay. So when I say about EAR, estimated average requirement, what is average? It is the mean. Okay. So where is the mean? In the center. The centermost peak, you see the peak of this belt, the peak of this mountain. This is where the EAR is. This is where majority of the population is. Okay. So the EAR is based on what is the age, average age of the majority of the population. Okay. So if you focus your national policies just on this majority, you are completely forgetting the okay, remaining important sectors of the population. Okay. You will only cover this almost 50%. Okay. Half of the population will be covered. You can see here, to reach EAR, you have to come halfway. Halfway you had come. So that's 50%. Remaining 50% is a question mark. Okay. Remaining question 50% is a question mark. So this is EAR. EAR rights is right in the center. Okay. This is the on the left side, what you see is negatives. That is the lower limits. On the right side that you see is the positives. That's the upper limit. Okay. You divide a graph into this 4 segment if you remember from your 10th standard and all. Okay. The negative and the positive side of the graph. Okay. So this normal distribution curve represents that. Okay. So to reach till EAR, you have come half the way through. Okay. But still you have only covered 50% of the population. Remaining 50, EAR does not cover. So that's when we have RDA. See where RDA is. RDA is on the positive side, which means upper limit. Okay. And RDA has covered all this blue part, all these segments. If you see, under 3 standard deviation, 2 standard deviation, 1 standard deviation, plus 1 standard deviation, plus 2. Okay. Up till 2 plus 2 standard deviation, RDA has covered. So all this area where RDA is written, okay, all this blue area except for this last triangular area, okay, all this blue area RDA has covered. EAR could only cover the left side segment from the 0, this triangle. If you see a triangle light of like situation, half of the bell curve. Okay, EAR only covered till there. RDA could go further and covered up till 2 standard deviation. Okay, so almost 97.5, 98% of the population is covered by RDA. This is the graphical representation of both these terminologies. Is it clear to all? You don't have to study the normal distribution curve, just for your understanding. So next, coming to factors affecting RDA. Okay, you can't make an RDA for a person of a specific age, sex, just like that. Okay, there are different factors that goes into preparing RDA. People in the ICMR, okay, Indian Council of Medical Research, they have to do thorough analysis of all these factors to come to a conclusion. Okay, and these factors keep changing. Why ICMR has to keep changing the RDA every year or every 2 years? Why does the what you see the same textbook, if you see the older version of the editions, okay, the RDA table is slightly different. Right now, the edition that you have is slightly different. And even in the future, when RDAs will be coming out from ICMR, again, the RDA will be different. Why? India is also growing old. It's a young country, it's a very young country, but still it is growing old. Okay, age wise, it is growing old. Sex wise, also, it is changing. The sex ratio is also changing. Just a minute. Am I audible? Is my screen visible? Am I audible? Am I audible now? Okay. So the first situation is variability in nutrient requirements. Okay. Variability in nutrient requirements. Depending on your age, sex of the individual, the nutritional requirement changes. Okay. The calorie requirement as well. For the same age, men and women, calorie requirement is different. The age, the sex is a factor there. Okay. Age wise, okay, what a 20-year-old young boy will eat is completely different from what a 70-year-old uh, senior citizen would eat. Okay, so age is also different. The physiology of the body, especially in women who are in the reproductive age group, okay, menstruation or pregnancy or lactation, these are different stages. During these time also, additional requirements and quantities of nutrients are required for the sustenance of pregnancy and lactation. Okay, so that physiological change also plays a factor. Then there is individual differences in terms of your height, body weight, okay, your lifestyle, your physical activity, the calorie requirement of a sedentary lifestyle person, protein requirement of a sedentary lifestyle person, and of a moderate to active lifestyle person is completely different. Okay, but that is lifestyle. Then height and weight, that also plays a very important role in determining what calories you should have. Okay, what are the weight goals that you have? Is it weight loss or weight management or weight gain? Okay, geographical location. Uh, can you give any example how geographical location will impact the nutrition? Any one example, whatever comes to your mind. What would be some nutritional examples you can give pertaining to geographical location? Okay, let's just take the same example of a 25-year-old adult from a completely different geographical location to completely different geographical location. in India. Both are Indian citizens. Both are 25-year-old. Same gender, same height, same weight, same BMI, same economic status, same physical activity. But still, their requirements, RDA requirements, may be slightly different. Any examples that comes to your mind? Yeah, in cold areas, those who live in like Tibet and all, Tibet, Leh, Ladakh and all, okay, they can eat more fat because it will be utilized. Those who are living in the coastal areas and all, they don't require much fat, right? Yeah, coastal regions diet is different than the mountain regions. The main mineral here is difference here is iodine requirement. Okay, in the coastal areas, you don't have to worry much about iodine. Okay, in mountainous area, hilly area, you have to think into from where will you get your iodine. Okay, so that's how geographical locations will impact. Okay, weather climate wise also the Himalayan foothills, their diet, the mainland Indians' diet. Okay, these are completely different. Then we have bioavailability. What is bioavailability? The rate of absorption of nutrients. Okay, you may be eating protein rich food, iron rich food, but how sure are you that these nutrients are getting absorbed in your body? Okay, you might be eating 100 grams of green leafy vegetables on a daily basis. Okay, you are making sure of that you are having 100 grams of green leafy vegetables on a daily basis. Okay, just to ensure that you get enough iron. But how sure are you that the 100 grams of green leafy vegetables are giving you enough iron? Your body is absorbing it, or are whatever food that you're having, maybe the iron is lost completely through excreta. Nothing has been absorbed. So that is the factor of bioavailability. Okay, the absorption or the bioavailability of nutrients from different diet can vary. Okay, and also the quality of the diet, the quality of the nutrient is also different in different forms of diet. In vegetarians and non-vegetarians, particularly, iron from non-vegetarian sources are easily absorbed. Protein from non-vegetarian sources are easily absorbed, assimilated. Okay, minerals as well from non-vegetarian sources are easily assimilated in your body. But in vegetarian sources, it is on the less side. Okay. And there are also different inhibitory factors that are present in various plant-based food. Okay, anti-nutrients we call them, phytates, tannins, okay, saponins and all. So they can interfere with the way how nutrients are absorbed. So that's the reason why majority of vegetarian diet have uh, lower bioavailability as compared to non-vegetarian diet. Then we have the relationship between nutrients. Very important to understand this interrelationship between nutrients. Okay. So, for example, iron and vitamin C, they have a chemical combination kind of a reaction. Okay, they combine well, they get absorbed well. Vitamin C enhances the absorption of iron. Okay, then we have competitive relationship, interrelationship. For example, zinc and copper. They fight for being absorbed. If any diet has more zinc, copper will not be absorbed. If any diet has more copper, zinc will not be absorbed. Okay, so these kind of different interrelationships are there. Precursor interrelationship, that is tryptophan to niacin. Tryptophan is a precursor to niacin. Okay, tryptophan should be present for niacin to be absorbed. Otherwise, niacin will be not absorbed. Niacin is vitamin B complex. Okay, tryptophan should be present in the same food, like when you combine dal and rice. Okay, the tryptophan present in both these cereals and pulses will ensure that the niacin present in these two is also getting absorbed. Okay, so that is a precursor relationship. Just an example, some nutrients should be present so that other nutrients can be pulled in. Okay, then there is an exchange interrelationship. For example, vitamin E and selenium. Vitamin E can get in when selenium can get out, and the vice versa also works. So this interrelationship between nutrients also has to be taken into consideration when you are making an RDA. Okay, this ICMR will usually do the in-depth research on that. Okay, so whatever RDA you see for iron, okay, or for vitamin C, it is made in such a way that on a daily basis, if you're having 40 gram to 80 gram of vitamin C, then 20 grams of iron will work for you. Okay, it's made in that way. Okay, then coming to general principles of deriving data. First is dietary intakes. So in this approach, it can be seen that energy requirements of children, based on that this dietary intake principle came into being. See, these principles didn't come overnight. Okay, extensive researches, laboratory trials, okay, these things were done, okay, to come into these conclusions. And these principles are always utilized when you finalize the RDA. Before RDA is been published for the public to be used, okay, these general principles which came from extensive researches are used again, time and again. Okay, so how children were observed for preparing your RDA? Usually healthy, growing, normal kids, how much energy they require, okay, for their healthy, normal growth. That was noted down. You can say maybe a 50 or 100 students from or children from various states of India, from various geographical location of India, they were observed over a period of time. Okay, and it was seen when you give a particular amount of calories to the children, okay, within few months they grow in a certain way. When you reduce the calories, they may uh, there are risk of stunting. Okay, the growth may be delayed. Okay, so these are extensive studies that are done, and conclusions, how much intake you should have, how much energy intake you should have. It generally came from observing growing healthy normal kids. Okay, kids who do not have, you cannot consider a child who is suffering from type 1 diabetes for these researches. The child has to be healthy. Okay, healthy growing children are used are being observed. There is no research that is done on them. Okay, they are just observed. The children who have enough amount of calories, how they are keeping up with their growth and development. Okay, how much calories can aid in growth and development, what nutrients can aid in growth and development. Okay, so that came through dietary intake research. Okay, next we have growth. Next principle is growth. So this is based on breast milk intake. Okay, any particular nutrient or the breast milk intake for an infant for a specific period of time, and then noting down how much the infant has grown or gained weight. In infancy, it is very easy to see if the mother is giving this much ml of milk on a daily basis, okay, or the mother is feeding the child these many times a day, okay, on a regular basis. How the child is keeping up with the growth, okay, how the child is gaining the weight or keeping up with the growth. Then nutrient balance, minimum intake of nutrient for equilibrium, that was the um, test done here. Okay, intake is equal to output, that is equilibrium. Okay, how much you are eating and how much you are taking out of the body, excreting, urinating, or through sweat. Okay, usually minerals can be calculated in this way. The RD of minerals usually come in this way. Okay, through urine, through sweat analysis, okay, through stool analysis, one can understand how much minerals was given to the person or a child and how much was being thrown out of the body. So intake versus output can be registered, and based on that RDA for the minerals, you can come into conclusion. How much mineral or nutrient was retained in the body, that can also be checked. Especially when we do this DIA score and all, okay, it is based on the nutrient balance principle. Then we have obligatory loss of nutrients. Whatever you eat, whatever mineral, vitamins, okay, or macronutrients, whatever you eat, not 100% of them is getting absorbed in the body. There will be some obligatory loss of nutrients from the intestine. Okay, 100% absorption will not happen. Some amount of it will be, some part of it will be lost either in digestion or excretion. So here analysis of your urine, feces and sweat is done to find out if how well the body is absorbing the nutrients from a particular source of food. Then we have factorial approach. Okay. In this approach, the requirements of different functions are assessed. Every vitamin may have more than two functions in your body. Okay, so based on those functions, so let's say vitamin A is important for your eyesight, your vision, for the cell differentiation of your skin. Okay, the major two functions of vitamin A. So how much vitamin A is required to maintain the cell differentiation, healthy cell differentiation? How much vitamin is required at minimum to maintain good eyesight? Okay, so based on the functions of different vitamins and minerals, if For example, if I plan that I will give only 5,000 international unit of vitamin A for this group of people, and let's see how their skin reacts in a month. Okay. And then I will say I will only give 3,000 international units of vitamin A per day to another set of people. And let's see how their vision changes, eyesight changes. Is it getting blurry? How much blurry? Okay. So based on the functions of certain nutrients within your body, how much vitamin is required in at the minimum so that all these functions are taken care of. Okay. For example, if I say for your healthy skin, acne free, healthy skin, okay, that is still young, looks young and plump, okay, let's say 7,000 international unit of vitamin A you require on a daily basis. Okay. To maintain your eye health, at least 5,000 international unit of vitamin A you require on daily basis. So you have 7,000, you have 5,000. Okay. For different functions, different baseline requirement is there of the same vitamin. Okay. One single vitamin is having more than two functions in your body. Okay. But to commit to those functions, different requirements are there. So how will we determine what is an absolute number we can give here in RD of vitamin A so that vitamin A can do all its functions properly? Okay. So if imagine if I make RDA of vitamin A 5,000 because 5,000 is enough for eyesight, good eyesight. Let's say, okay, 5,000 international unit of vitamin A is enough for eyesight. Will that be okay for the population? Functionally speaking about vitamin A. For healthy skin and all, at least 7,000 is required. Healthy differentiation of the body. But since eyesight is very important, it's an important sensory function. And for eyesight, only 5,000 is required. So will it be okay to make just 5,000 international unit of vitamin A on a daily basis as a baseline for everyone? Will that be okay? It will not be, okay? Because still we are focusing on a holistic approach through diet. Okay, the importance of RDA is not just maintaining the eye health, but overall health. Okay, just to maintain one main sensory purpose and making the RDA based on that main sensory purpose and forgetting about the other functions of vitamin A that is there in the body. Okay, you can't do that. Each function, that is factorial approach. Factorial means you are categorizing the functions and each functions have specific amount of vitamins and minerals that should be there in your diet. Only then these functions can take place. So taking account of all those functions a vitamin, mineral, or carbohydrate has to do in your body, taking account of all those areas, you come to a value that at least if you have 7,000 to 8,000 international unit of vitamin A on a daily basis, all the functions of vitamin A can be taken care of. Okay, like that. So that is factorial approach. Based on functions, you will determine how much vitamins, minerals, or nutrients are required in your day-to-day diet. Next, you have the nutrient turnover ratio. So data from turnover of nutrients in healthy persons are labeled. Okay, nutrients are labeled, have been employed. Requirements of vitamin A and vitamin C, iron, vitamin B, they all were checked using the nutrient turnover ratio. Okay, it's a complicated research. Here you are using isotopes. Okay, isotopes of either vitamin A, vitamin C, iron. and that is given. These radioisotopes are given to the human. Okay, either it can be done on animals or humans. So you can do this, and then you will collect the stool samples, fecal matter. Stool samples will be collected. Okay, and from that you will find out the isotope. So let's say 10 gram of isotope iron was given, and in the feces you found at least 4 gram of the isotope from a particular source. Okay, and from another source you only found 2 gram of iron isotope from the fecal matter. So this will be an important decision. Okay, a conclusion to say that when plant-based iron source was given, the body did not absorb the iron completely. Majority of it was lost through feces. Okay, because 4 to 5 gram of isotope of iron was found when plant-based iron source was given. When animal-based iron source was given and when the stool sample was collected, only 2 gram of isotope was found. Iron isotope was found. So majority of the other isotope which was given, at least 8 gram of it, has been absorbed in the body. Okay, so from that you can understand how we can conclude which source of food is better in terms of bioavailability. Okay. Then we have the depletion and repletion studies. Okay. From the name itself, depletion, repletion studies. It's not done on human subjects. Okay. It's usually done on laboratory animals and all, guinea pigs and all. Okay. So depletion, what you have to do, you have to select one nutrient, let's say vitamin B. Okay. You will not give vitamin B at all to the subjects. It could be laboratory animals. Okay. You will not give this vitamin B at all to the subjects until and unless they become deficient in that. Their body is completely depleted in that. They become deficient. How you will understand they are deficient? You have to regularly collect the samples, stool samples or blood samples from the test animals. Okay. So once you understand they have reached the deficiency level, okay, you will get to know from when did you start this experiment. From the past 2 weeks, you are not giving any vitamin B to this set of guinea pigs, and finally in 2 weeks they become deficient. So you can make a conclusion. If you don't have vitamin B rich food for more than 2 weeks, you will be deficient. You will fall ill. Okay, that statement conclusion will come from the depletion study. Now, repletion study. Now these guinea pigs are depleted. They're deficient. Slowly you will start adding vitamin B in their diet. The first day you will just give them 5 gram. Second day 10 gram. Third day 15 gram. Okay. So day by day you will keep on increasing the vitamin B back into their diet so that their bodies become repleted. Whatever was lost completely vanished and deficient, now it is getting repleted back. Okay. So you will you will keep taking the blood samples, stool samples to understand when these mice become, or the guinea pigs, when will they become deficiency free in vitamin B. Okay. And one fine day you did a blood sample test, stool test, and you found that all the mice are responding well. They don't have any deficiency. They are not at the toxicity level. Okay. They are in ideal stage of having enough amount of vitamin B. Then you will look back and see how many days we have to feed them and how much amount of vitamin B was being given to them so for all these days that finally they are out of deficiency. Okay, so when you do repletion and depletion studies, you will get these two answers. How long can you go without a nutrient to become deficient in that? And how long it will take you to become normal in that area? Okay, is it clear? Depletion and repletion studies. The determination of RDA of different nutrients, energy does not have an RDA. Energy is completely based on your expenditure. Expenditure, it doesn't not money, your energy expenditure. Okay. The more you spend your energy, the more you will have to eat to maintain your body. Okay. It is completely based on personal goals as well. If you want to lose weight, you have to consume less calories and burn more energy. If you want to gain weight, you have to consume more calories. And if you want to maintain your weight, whatever energy expenditure you are doing, you have to replenish it. Okay. So energy usually will not have a recommended daily allowance. It is completely based on your physical activity level. Okay. Then proteins, to understand how much protein will a person require based on their physical activity, their age, their gender, how much protein should I take? Okay. When this question arises, we usually check their weight. Okay. If they have a sedentary lifestyle, it's 0.8 into gram into their weight. That much protein they should consider having. That is at the baseline for a sedentary. Okay. And usually we use the DIA score, digestive indispensable amino acid score. The DIA score is used to understand the quality of protein. Okay. Which protein is best absorbed, which protein is not absorbed better. The DIA score will give you that. So considering these two areas, the quality of the protein and the lifestyle, that will determine your RDA. Then we have fats and oils. So according to the Food and Agricultural Organization, FAO, and WHO, World Health Organization, it is considered that 25 gram of fat for men who are sedentary, who have a sedentary lifestyle, 30 gram of fat for moderately active men, okay, and 40 gram of fat for heavy activity men. When it comes to women, it is little bit on the lesser side. Just 20 gram of fat for sedentary women, 25 gram of fat for moderately active women, and 30 gram of fat for heavy active women. No, a person who is going to gym will not have 0.8 gram. They should have at least 1 gram of protein per kg. Okay. Depending on how much time they are spending in gym, what kind of exercise they are doing in gym. Okay. If they are doing a lot of resistance training, the protein intake will go up. Okay. So that was about the fat and oils. Whatever happens, more than 50 gram of fat should not be taken by adults. Minerals like calcium, phosphorus, iron, iodine and all, it is intake versus loss. How much minerals are you eating? How much are you losing? Okay, that is intake versus loss. RDA is not followed for malnourished people because those who are undergoing malnourishment, it's a clinical situation. RDA is meant for healthy people. Okay. Remember the 97, 98% of population that is covered, we considered them healthy. The remaining 2-3%, that is what we consider as a population who might be suffering from some chronic diseases. Okay, could be sports people who are spending extensively on their energy, and also malnourished people. Okay, for obese patients or obese people, fat, carbohydrates, and energy. These are the areas that RDA will not matter, but minerals, vitamins, protein will not be much affected. When we talk about RDA, it is whole and whole of all vitamins, minerals, macros, etc. Okay, obesity is not much affected by minerals. Okay, minerals and vitamin requirement will remain same. If you are a 30-year-old slim person, 30-year-old obese person, your vitamin and mineral requirement is the same. Where you have to change is the calories. Okay, vitamins and minerals don't give you calories. Okay, calories is given by the topmost calories are given by carbohydrates and fat. They give you calories. So you have to be worried about that. If you're obese, worry about calories given by carbohydrates and fat. Protein calories, you don't have to worry much because that's the last resort. Okay. So calcium, usually we go for 1,000 gram for adults, senior citizens and lactating women, 1,200 grams. Iron, it will be increased during pregnancy. Requirements are increased during pregnancy. Iodine, you can meet the iodine requirements through fortified food. Vitamins, it is dependent on turnover studies, depletion and repletion studies. Just now I have given an example of. Okay, based on the depletion and repletion studies, the RDA committee will come into conclusion how much vitamin has to be given for this particular group of population. Okay. So this is the old Indian reference man and woman. Right now, the Indian standards have changed. Okay. Height and weight recommendation is mentioned in the book, page number 21. You can refer that for understanding for a particular given height, what should be the ideal weight. Okay. 3 or 4 kgs up or down is fine. 3 or 4 kgs up or down is fine because you have to consider water retention as well. Okay. For example, let's say a person who has 163 centimeter height. What is their ideal weight from the textbook? Table 2.4, page 21. Yeah, 55.8, almost 59 kgs. You round it up, it is 56 kg. Okay. So add 4 to it. 60 kg is still fine for a 163 centimeter person. Minus 4 kg from it, 52. That is also still fine. Okay. So 52 to 60 will be an ideal range for a person who is 163 centimeter tall. So you can refer those chart to identify the ideal ideal weight based on height. Indian reference man and woman, just read it. Okay. It is not the ideal man and woman, but majority of the population, because it is under this age group. Okay. And the average weight of the Indian man is around 1.77 meter, 65 kg is the average weight for Indian men. It's the average. Does not mean it's the ideal. Okay.
And for Indian reference women, again, the age group is still young, 19 to 39 years, 162 centimeter, 1.62 meter is the average height, and weight is around 55 kg. Okay. So coming to the practical applications of RDA, where and how RDA is used. This information of RDA, that ICMR RDA table that you see, where is it used? Okay, how can it be used? What are the practical applications of it? Okay, so first is to assess the adequacy of national food supplies, ration shops and all, right? Every geographical location has their population data, demographic data. Okay, in their district, municipality authorities will have that data. Okay, their panchayat will have their data. How many houses are there? What is the occupancy rate? Okay, how many families are there? How many men, women are there in the population? What is the age of them and all? Okay. Um, State government, national government, they all have these details. District wise distribution of population, everyone has. Okay, majority of this data is available. So based on that data, you come into conclusion how ration shops, okay, has to be supplied. Okay, so that when the families approach it, when that entire town or village is approaching the ration shops, the ration shops have enough to feed the community, feed the demography of the community in a healthy way, so that there is no malnourishment. So for supplying food, okay, to the population through various uh, government supply routes, okay, to understand that, okay, for example, in UP, if UP there is a small village of 1,000 people, or say, since it is UP, let's say a small village of around 3,000, 4,000 people. Okay, there would be a ration shop supply. Okay, and let's say there is Odisha, a small village, same small village. Odisha may have 1,000 people in that village. So the amount of people that the ration shop has to supply, both are small villages. Okay, um, is one is 1,000, one is 3,000. Definitely, the supplies in the ration shop will be very different, even though it is supplying to small villages. Okay, supplies in Odisha's village will be less as compared to UP's village. Ideally, it should be like that. There are factors of corruption and all. We are not going into that, but systematically speaking, this is why RDA was brought up. Okay, so that based on the details of RDA, based on the information of RDA, we know exactly how much to be supplied through the ration shops, so that majority of the healthy people are covered and they stay healthy because of this supply of food. Okay, and also to provide dietary guidelines to people who are living a healthy life, or to make a balanced diet for a group of people. Okay, for example, let's say you are a school teacher. Okay, you have mixed school, okay, with boys and girls. You can distribute some diet plans to their parents to make sure that these diet is followed at home for the children of this particular class, because they are in certain age. Okay, they have certain activities planned out, so this kind of diet would be better for this particular age group. And how did the teacher get to know about the information? She used the RDA table. Okay, so it's to provide dietary guidelines to the parents. To judge the intake in terms of intake output, and to understand if you are having enough food or not. Okay, if it is too less for your age or too high for your age, are you going towards deficiency or are you going towards toxicity? Okay, to make these judgments, RDA table is used. For example, if let's say a 25-year-old woman comes to you and tells you that I have calcium tablets 2 times a day, and I'm also drinking milk, whole skimmed milk, 2 times a day. Okay. What judgment will you make here? She's having calcium tablets. She's also having two full glasses of huge glasses of milk on a daily basis. 25-year-old female. There is a risk of calcium overload. You can guide her that either take one calcium supplement and 1 glass of milk. Okay. If she's taking two calcium supplements, she just can leave with half a glass of milk. That is also completely fine. Okay. Like that, you have to give the advice. So when you know about RDA, when you have a knowledge about RDA table, only that's when you can understand, okay, they are saying they are having so many things. Okay, you can tell them what you're doing is little bit wrong. You have to cut short in these areas. You have to add more in the other areas. Okay. In case of pregnancy, 1 liter of dairy products on a daily basis you have to have. Either milk, buttermilk, curd, in any form. Okay. So in case of pregnancy, if you are taking 1 liter of dairy products, there is no need for taking calcium tablets. If you cannot take 1 liter of milk or 1 liter of dairy products, then yeah, you can take help of calcium tablets. RDA is not applied for undernourished or malnourished. Then you can just check this My Healthy Plate by National Institute of Nutrition, Hyderabad. Then in the headquarters is in Hyderabad. Okay, this is the My Healthy Plate. So half of your plate should be of fruits and vegetables. Little bit more than 1/4 of your plate should be of pulses and cereals. Okay. And then some fat, oil, nuts and seeds. Under fat and oil, you can add sugar as well. Okay. They have not mentioned, but sugar can also come in this category. Then apart from that, separately dairy products, milk and curd. Milk or curd or buttermilk can be added. So this is an ideal meal for Indians. Okay, because you can see majorly pulses, egg, flesh food. Okay, that for non-vegetarians. Usually, Indian diet has all these elements, but portion size is different. Is different. Okay, majority of 3/4 of the plate in India is usually just rice, just the grain. Then some sabzi, some curry will be there. Okay, that is not the ideal way of eating. So that's about RDA. If you